While sophisticated medical technology is available in health systems across the globe, further advances are constantly being made to better the lives of countless individuals. Let's explore the next generation of medical technology. The early detection of any disease can result in more favorable patient outcomes. While lab testing plays a key role in diagnosing disease, there's little focus on developing or using new and improved lab tests.
Laboratory tests have a huge impact on patient care because lab test results define the disease process. And without defining the disease or having the proper diagnosis, you can't hope to achieve adequate outcomes. The challenge is convincing patients and doctors to adopt new lab tests when they become available.
Heart disease is the leading cause of death in the U.S. and stroke is number 3. Although they can be prevented in almost all people if caught early enough, most people are unaware of the risk that they carry, in part due to the widespread use of outdated lab screening tools. Dr. Paul Zyka is director of the Florida Lipid Institute in Winter Park, Florida.
66% of heart attacks happen in people who have normal cholesterol levels. It's obvious we need a better way to identify people at risk for a premature event. A regular lipid panel is no better than a flip of a coin in identifying who's going to have a heart attack. There are much better tests available, but most physicians and patients aren't aware they exist.
With the majority of physicians relying on outdated testing, the first time they discover their patients are at risk is after their patients have suffered a heart attack or a stroke.
There's a new test for Lp(a). It's an inherited cholesterol particle that's often referred to as the widowmaker gene because the cholesterol content of Lp(a) is 10 times as predictive of a premature heart attack as LDL cholesterol. Most cholesterol medicines don't affect Lp(a), but there are effective treatments if the provider knows that it's elevated.
Heart disease or heart attacks are caused by atherosclerosis, which blocks the heart's arteries. There are many different metabolic abnormalities that can cause atherosclerosis, and you need to know which of those abnormalities you specifically have so that you can customize the treatment plan that works for you.
Founded in 2003, Hunter Laboratories is the largest privately owned and fastest growing clinical reference lab in Northern California.
We're a clinical laboratory located in Campbell, California, with the newest and most automated laboratory instrumentation and technology available. Our business is now expanding from Northern California to across the U.S. and around the world. We provide testing of blood, body fluids, and tissue specimens to assist physicians in diagnosing and treating disease.
Its Hunter Heart program incorporates new technologies that offer a much greater level of precision in diagnosing and managing heart disease.
Cardiovascular disease is the #1 killer in the Western world. We wanted to see if there wasn't something our lab could do to make a change. Our research convinced us that this disease was preventable for almost all people. And for those who already have the disease, it could be better managed with newer testing information and personalized therapy plans.
Having lost her grandfather to a heart attack in his early 40s, Linda Usauce wanted to know her risk of having heart disease.
I have a significant family history of premature death from heart disease and stroke. I recently learned that there are hidden risk factors that no one is testing for. Learning that Hunter has developed a test panel with a simple blood test that will give me a better picture of my heart risks was significant to me. That information enabled me to take control of my health and, more important, taught me simple things I can do now to prevent the disease rather than slow its progression later.
Through its push toward personalized medicine, Hunter Laboratories expects to improve patient outcomes and to dramatically lower the cost of heart disease in the Western world.